So today I'm going to talk about why it's so important for us to stay socially isolated till May 3rd and even afterwards to take precautions once the lockdown lifts after May 3rd. Because one person can lead to thousands of infection within days. And today, data released by the Health Ministry shows that close to 30% of all coronavirus infections across the country, and that is in 23 states and UTs, are linked to just one cluster in Delhi, which is the Markaz cluster in Nizamuddin. So, the data released by the Health Ministry on April 18th on Saturday shows that 4,291 cases of the 14,378 cases across the country are related to the Markaz. And around 40,000 people who are under quarantine across the country are either people who attended the Markaz congregation or are people who came in close contact with them. So as of Saturday, 23 states and UTs had cases related to the Markaz, and in the high burden states which are struggling to contain infections, the cases related to the Markaz were really high. In Tamil Nadu, about 84% of all cases were related to the Markaz, in Delhi, 63%, in Telangana, 79%, and 59% in Uttar Pradesh. And what's equally worrying is that even states that have a few cases, I mean, these are states which have so far otherwise escaped infection, have had cases which are related to the Markaz. So you have one case in Arunachal, 32 out of 35 cases in Assam, and 10 out of 12 cases in the Andamans. So what I'm really trying to say here is that it's just this one person who doesn't follow the social isolation rule, who doesn't wear mask, who doesn't take the proper precautions, can infect thousands of others unknowingly. So the Health Ministry on Saturday also released data related to deaths in the country. So with close to 15,000 cases, we've had 480 deaths. So that means the death rate is about 3.3%. And 83% of these people had existing disease, had existing chronic illnesses like heart disease, hypertension, diabetes, and kidney disease. And among the people who died, 75.3% were people over 60 years old. And the deaths were highest among people who were 75 years and older, with 42% of the deaths being in people in this age group. But the happy news again is that close to 2,000 people have recovered, and the recovery rate is way higher than the death rate, which is always a good sign. So we've had 13.85% people recovering, and they've gone home, they are back to their normal lives, so which is always a great thing to hear. So I just want to end this with again saying that one person can infect thousands, so we have to be very careful. And whether lockdown or no lockdown, we have to take precautions and ensure that we don't go around infecting others, we don't get infected, especially now that there's a lot of evidence that shows that even asymptomatic people, I mean, people who don't have symptoms but who are infected, so and if they don't have symptoms, then they obviously won't go and get tested. So even asymptomatic people can infect others and cause serious disease in other people. So we have to look after ourselves, we have to look after people around us. Guys, take care.